It's Mighty Duck time! Emilio!
Emilio!
Go on, guys. Good. Let me see it. Oh yeah, wet butt. Fan. Does it have an F? A F.
No.
Where's the F? Nice! Good job, buddy. Alright, let's try this one more time. I have toothpaste on my shirt. I know that. I'm just going to leave it and roll with it. So, this is the second time making a video. Hopefully we have a little bit of an easier time. So, my name is Kate. If you don't know me, I am chronically undiagnosed. I have been tested repeatedly for honestly endless amounts of things, and we have never found anything. So, I am fighting to get a Elhers Danlos diagnosis. And today we're going to dive a little deeper into what Elhers Danlos is, what it affects, because like Google, if you search it up, it's like, oh, it affects your joints. And, sorry, my computer. It's not exactly true. Like, it affects way more than just your joints. And a lot of people don't understand that. So we're going to go through different things and how I know what I have is Elhers Danlos and how I know it's not these other things. First off, let me say, like, I have been tested for Lyme's, rheumatoid arthritis, diverticulitis, IBS, like all these stomach problems, problems with my uterus, like endometriosis, polyps, cysts, pox, like you name it. I've been tested, and every time that a doctor tests me, it comes back negative. Everything comes back completely healthy. All of my levels are completely normal, and everything looks fine, and it's not. So, I know some people are going to be like, well, have you had your thyroid checked? Yes, on multiple occasions, I have had my thyroid checked. I've also had them do a full spectrum to look for Hashimoto's, and it's all normal. Lyme's disease has been ruled out. Rheumatoid arthritis, ruled out. I do have arthritis in my joints. I do not have rheumatoid arthritis. I don't have any diagnosed stomach conditions. Sorry. Something burns. Every time I go for something, they haven't been able to find anything. I've had upper GIs, colonoscopies, you name it. I've been tested for MS on 2 or 3 different occasions, and it all comes back normal. So, saying that, okay, I know that I am not normal, and I live with pain every single day. And we're going to go through some of the symptoms that I experience, brain shortage, and explain the different, what Elhers Danlos is, and then I'll walk you through all of what it affects and how it affects me, okay? So the technical definition on Google, I pulled up Google, and Elhers Danlos is Elhers Danlos syndrome affects connective tissue, primarily the skin, the joints, the blood vessel walls. Symptoms include over-flexible joints that can dislocate skin that's translucent, elastic, and bruises easily. In some cases, there may be dilation and even rupture of major blood vessels. Okay? Now, I haven't seen any problems with my veins, although when I do get blood work done, normally they move. They're very hard to get, even though I can see them very plainly on my arm. They're really difficult to get a draw on. And a lot of times when I do get a stick, I end up pop it or whatever, and I get a big bruise. So I do have trouble with that, but other than being able to see them, That's the only thing that really causes problems. So I do have very elastic skin. Like, I can pull my skin out. It's just whatever. Like, I'm gonna be really red, but normally they say that, like, I've seen where they can pull it out really far. I'm not like that. I can do my elbows as well. Not sure about my knees, but that's another place that they said was usually pretty elasticy. Your neck, knees, and elbows. So going from there, joints. It definitely affects your joints. I am super mobile. That is the most common. There are 13 different types of Elhers Danlos, being the main one being hypermobile, or the most well known is hypermobile. When they look for that, it's like, you know, I can touch my thumb to my wrist on either side. I can bend my pinky all the way back. I can put my arms behind my back and touch them in a prayer motion. I can reach behind and touch both hands behind my back. I can bring my feet up to my head. I can do splits, normally front ways. My hips lock up sideways.
Mommy?
And I am not a gymnast. I have never done any kind of training. I did yoga for a little while, but I was always super flexible before that. So that's not, you know, anything. Yeah, buddy.
Mommy, my birthday's all the way
11 days, dude.
11 days.
Yep.
And what's that for? I got a cut right there from a big knife.
Oh, okay.
But it's not bleeding or scarred.
Okay. All right, we're gonna keep going. Okay, so it definitely affects your joints. I have the only place that I've really dislocated is my ribs. Like when I'm pulling vines or anything like that, I've dislocated my ribs on numerous occasions. It's usually the two bottom on my left side. They kind of just pop out of place, and I have to go to the chiropractor and have him shove them back in. Normally it bruises my lung, and it's very, very painful, and it's extremely hard to move. That's the only thing I've ever dislocated. So when I started looking at Elhers Danlos, I didn't think that I fit the criteria just because I didn't have any dislocations. But that's not true. It's not for everybody. Everybody's different. Some people can pop their thumbs out of place, kind of stuff, but like I can't do that. I am super flexible. Like I can hold on. I can like bend all my fingers together. I can bend my thumb backwards, kind of stuff. And I know you're like, ew, but it's just something that I've always done, and I thought it was a party trick, and it's not. I didn't realize that it wasn't something normal. So let's go on to the next thing. I have had stomach problems since I was in high school, and I didn't realize that that was anything. Like, they had tested me for numerous stomach problems, diverticulitis, IBS, I can't even think of all of them. Even cancer. Like, they checked me for everything, and I was as clean as a whistle. The only thing that they could find was I had some small tearing in my lower bowel, which caused bleeding, and they're like, we're not really sure what's going on or why that you have bleeding there, but this is the only thing that we could find. So they ended up diagnosing me with IBS, but they just said, even when I was talking to the doctor, they're like, we have no proof, but we believe that you have IBS, because that's the only thing that we could think of, like, that we ruled out everything else. So I heard
Don't
something.
look at me.
You look good, dude. So Elhers Danlos affects your stomach. Let me see. It affects it through the connective tissue that is present throughout the body. Many different structures around the body include the digestive tract, can be affected by EDS. Ooh. It is essential to the passive mechanical movements needed to complete digestion. I'm doing a quick read through.
Mom, look at me. Look at me and Boomer doing. Look at
Yeah.
me and Boomer, we're snuggling.
Hold on, buddy.
Look at me and Boomer. Quick. Quick.
I'm trying to find something. What sort of gut problems can occur?
Quick.
I see.
They're snuggling.
Okay. So your digestive tract that it can affect is honestly literally from your mouth all the way to your sphincter. Yeah, we're gonna say it like that. Okay. And it affects many areas of the digestive tract, include upper digestion, the esophagus, the stomach, and the duodenum, and the lower tract. Man, I had one up earlier. I should have found that one instead. I just kind of clicked one. Why isn't this working? Okay. The most frequent reported problems affecting the upper digestive tract are acid reflux, chronic and recurrent digestion with pain or discomfort, and early fullness after meals. The lower digestive tract can present problems such as constipation, abdominal pain, bloating, diarrhea, and the feeling of general abdominal discomfort. Nausea and vomiting can occur alongside any of these symptoms described above. I can attest to all of these. You definitely have, like I have had acid reflux, especially when I was pregnant. It was really bad, but it's been kind of coming back in the last year or so, depending on what I eat and drink, really. But like some days, like I could drink water all day long and eat bread and I still get acid reflux. When I was pregnant, I was nauseous and vomited the entire pregnancies, both of them. It was really, really bad. And I know that EDS can really affect your pregnancies and makes it actually a high-risk pregnancy, but we're going to go into that another day. Okay, so I have had the constipation and the abdominal pain, which is so severe that it actually had caused intestinal bleeding. And this was back when I was in high school. I ended up leaving school and I would stay home because the pain was so intense that I couldn't go anywhere. And normally after I would go to the bathroom and like empty my entire intestinal tract, then I would be okay. But then the next day, as soon as I started eating again, it was like it started all over. It started the whole process over. I ended up cutting out a lot of foods, sticking to like a clean eating diet, avoided fast food, sodas, everything. Pretty much like a brat diet for like 2 or 3 years. And I started seeing a chiropractor, and he really helped get like my back and stuff in alignment. Bubba.
Let this sneeze.
Okay. And it was thanks to him that I ended up getting better, but I ended up dropping out of school and finishing everything online. It was that bad. It's like somebody was sticking a fork in you and twirling your intestines like spaghetti. It's unbelievable how painful it is. Also, bloating is definitely a real thing. This last year, my bloating has been through the roof. I had to stop wearing regular pants. If something's too tight, it makes me sick. I went up in, I want to say 15 to 20 pounds. And I know that sounds really bad, but it is. I stopped working out because anytime that I would work out, my joints would hurt, but also...
Did you see a snow on you?
No, you give that to me now. Every time that I would work out, it would cause a lot of stomach cramping and a lot of pain. So I ended up having to stop. That was when I did Taekwondo. Ethan, we had this talk already. If you're going to act like this, you have to go out. Sorry. Okay. It was super, super painful. So if I did anything like, when I would do Taekwondo, my knees would be really bad and it would cause a lot of cramping and a lot of stomach pain for several days afterwards. So I ended up stopped doing that, and just tried to do yoga, which I found out that yoga is really bad and you shouldn't do that, but you know. Anyway, so there are some things that it says. I can post links to all of these with the video so that way you guys can read up. And there is an Elhers Danlos, Ethan, you need to clean that up right now, website that is dedicated, and you can read through all of their information, because they do list everything and go into really big detail, especially like bloating. Abdominal bloating is a common symptom of people with EDS, which is hypermobile EDS. Although the underlying causes are not fully understood, it is thought that
I think there's only one.
not even dysmodal I can't pronounce that. Maybe contributing factor, overgrowth of bacteria in the small bowel can occur if there is stagnation within the bowel. Okay. But yeah, there you go. But it tells you what everything affects and how complications, everything. So, all right, let's go on to the next thing, which is gonna be a little bit of a hard topic. Sex. Okay. Doing the deed. All right, so EDS is more commonly reported in women than in men. Its prevalence is roughly 70% in females and 30% in males. Okay? So women, there are a number of gynecological effects that EDS can have, which could affect a woman's sex life. I should bleep that out. A woman's, life. Okay, that was embarrassing. Women with EDS commonly experience problems with a pelvic floor. Such pelvic floor disorders can lead to issues such as painful sexual intercourse, pelvic organ prolapse, weak organ tissue, or is where organ tissue bulge out of the, as well as urinary incontinence, which is the loss of bladder control. The weakness of a pelvic floor muscles can lead to trouble with organs. I can attest to most of this except for the pelvic organ prolapse, which I started going to, Ethan, stop please, going to pelvic floor therapy, especially for my painful cycles, because I ended up having to walk around with ice on me, and it was so painful. Some days I couldn't even walk. It would go down in through my legs and my feet, my back. It was so extremely painful that I couldn't function for like 3 days. What are you doing? Oh, okay. So I don't want to read the rest of these. I might just post them because I feel like I'm going to get censored. But I can attest to most of these, especially after having kids. I noticed it got a lot worse. My pelvic floor, it's like, what pelvic floor? The urinary incontinence, which most women are like, well, that's part of being a mom. No, it's not. If you have a good pelvic floor, you shouldn't have any problems with your bladder. You shouldn't have any problems sensing when you have to go to the bathroom. If you've emptied everything out, you shouldn't have any trouble going, number 2. And
Hi.
you shouldn't have any issues with that. And if you are, see a pelvic floor specialist, because they are awesome and they can get you back on track. So let's go over the men, which I can't really attest to these because I'm not a dude. Okay, it says, although it's less common, EDS can affect men's sex lives. Pelvic floor weakness occurs in men just like in women and can lead to erectile dysfunction. I don't know. Case reports of men with EDS also found, cryptorchidism. I don't know if I said that right. Issues with testicles not descending, not producing enough testosterone or sperm, tight foreskin to testicular abortion and penis fracture. Oh, I didn't need to read that last part. Okay, thank you. Can you go on out? Get down. That sounds just painful. I can't attest to any of those, but it sounds very, very disturbing. So, yeah, I'm going to post that definitely. I'll post a link for you guys, okay? We're going to go to the next one. Okay, so, the next thing that I've noticed is foot pain is insane to the point where I wear house shoes. I wear Crocs. I'm trying to get my shoes off. I wear Crocs every day, and I don't take them off unless I'm in the shower or I'm getting changed, because if I'm wearing anything, like I'll wear sneakers and stuff, but if I wear anything else that has a kind of a hard sole or a dense sole, my feet are in pain. So yeah, I'm not gonna do that. Okay, let me see if I can find it. Many people with hypermobile EDS have low arched or flat feet. Not true. I have a high arch. That I might not be most people. Ethan has flat feet. And not fully understood. There's some big words in here.
I was showing you right now.
Nope, not right now.
It's right now.
Nope. This doesn't stop. Tell me anything. Like the one that I had given specifics on the foot pain, common foot health problems. Okay. In a dedicated foot health service, nail care and callus reduction, footwear advice and provision, and orthosis insole prescriptions. I feel like they don't really list anything. Nail problems. I don't know if I want to read through that. I don't like feet to begin with. It says difficulty with hand function coupled with painful upper and lower limb joints. Yes, to all of these. May also make it difficult for someone to reach and cut their toenails.
TV, right?
Inappropriate cutting of nails may lead to infection in the nail bed and grown toenails. I definitely have those problems. I ended up having to have the corners of my toenails cut out because I would get constant infections in my nails. Like they can never just grow out. They would always get really, really painful. Ew. Some kind of warts. I don't want to read this. Can we skip? It doesn't cause any harm unless it penetrates the skin, where it can cause a wart. Ew. Calluses, fungal infections. I just want I don't need to know about that stuff. I know I have foot pain. I think I clicked on the wrong thing. Does Elhers Danlos cause foot pain? Several studies have reported foot pain in people with Elhers Danlos, along with other problems related to pressure distribution on the foot while standing or walking, altered walking patterns, and postural instability while walking also have been observed. Let's check this one out. Put that back, please. Okay, they have reported foot pain. Just read that. In a study of 36 patients, 88.9% women. Patients in the study were given custom-made foot orthosis. Orthosis? It's gonna keep going. Inside their usual footwear for at least 7 hours a day for 3 months. The majority of the group, 72%, were hypermodal, 8% were classic, and 8% were vascular. Put that down right now. Now, This is your last straw. Last warning. Put my thing down. Put it back where it was. They saw improvements were seen in the patient's foot functionality, and mobility and fatigue, which happens. How do I know this happens? One, I wish I had an actual answer or actual term for the foot pain that we have, but it's mainly in our heels. I'm guessing it has something to do with pressure, but I know that like if I'm carrying a lot of weight, it gets worse. So like the other day I took a bunch of sand out to the sandbox and carrying a 50-pound bag. The next day I was almost not able to walk because the pain was so bad. I need something on my eyes. Don't look at my eyeballs. Okay, that looks better, honestly, even though I look weird. I don't look tired.
Mommy.
Okay,
Mommy,
so anyway,
Mommy,
yeah.
Let me tell you something.
Yeah.
You're not old.
Okay, I'm not old?
No.
Okay, I can roll with that.
Wildness.
So the other thing that it touches base on is foot fatigue, which happens a lot of times when I'm very tired or it's been a long day. Going through a area that has a like changes floors, you know, like the floor goes up or whatever, changes altitude. That is really hard. A lot of times I struggle and I end up falling or I end up tripping. A lot of times like my feet just, they don't, when I pick them up to walk, they kind of just drag. So I know that happens a lot. I honestly have a cane for days where I'm really tired or I think it's gonna be a long day and I think I need a little extra help. So I know that happens and I definitely have the foot pain that goes with it. I wish I had a technical term. Like I saw one that said, you know, it has something to do with these little polyps of like fat or something that are in your feet, in your heel that cause pain.
Mommy, here's my picture.
It's beautiful. Can you make me another?
Yep.
There's crayons down there in the side bin, okay?
Okay. I found it.
All right. So the next thing is eyes. I have a lot of problems with my eyes. I have been going to the doctor and getting glasses because my vision fluctuates. Like trying to talk to you guys, my like goes in and out of blurry. So it says blurred vision. It comes and goes with difficulty in accommodation, double vision in out of one eye or in both eyes, light sensitivity. That is 100%. A lot of times I need sunglasses when I'm outside, and I definitely did get the blurred vision. Complete or almost complete loss of vision in one eye that lasts a few minutes. Migraine, auras. I can't even read that last word. Dry eyes, tunnel vision, floaters, flashes of light, vision that is not fully correctable with glasses or soft contact lenses, and myopia, nearsightedness that increases very quickly. Within the last year, I went from just having an astigmatism with a sensitivity to lights and glares to I should be wearing glasses full time, but they irritate me because I feel like I just got them a few months ago and I feel like I already need a new pair because I try to use them and they don't help my eyes at all. Oh my gosh, look at this. Thank you. Give me a hug. Give me a hug. So we're just going to keep going with that and we're going to breeze right through. I know like the only thing I can say is a lot of times with the eye problems, I will get pain in my eyes in or around. They feel very tired. They feel very tense. And when that happens, normally it leads to a very bad headache. I did get a gua sha, which if you don't know what a gua sha is, let me show you. Mine's made of rose crystal. And it looks like kind of like a weird shaped heart, but you use it on your face and it's so cold. A lot of times, like if I'm having trouble, I just put it on my eye or I will put it on a tension area like right here, and it really helps release some of that tension and it helps my eyes feel less irritated. So, either that or I take a nap.
Your new flower.
Lastly, we have Elhers Danlos Syndrome is...
Here's another flower.
Thank you. You should see this face. Look at him. He's so brown. Love you, dude.
Do you have lipstick on?
No, I don't have lipstick on. No makeup today. No makeup Tuesday. The last thing, Elhers Danlos has been identified to have a link between autism and ADHD. So I don't know if I have either of those. It wouldn't surprise me if I do, but I don't have any of them. But we're going to read through it really quickly. It's a group, Elhers Danlos EDS is a group of hereditary connective tissue disorders. Usually this is because of a lack of collagen, by the way. I read that somewhere. It has, I'm getting tired, heritable impairments in growth and repair of the connective tissues of the body. These include tissues such as ligaments, tendons, skin, bone, and even blood and fatty tissue. Connective tissue acts like glue that holds the body together. There are 13 types. 12 are considered rare. And typically present with mutations in collagen or collagen-related genes. Collagen proteins are major building blocks of connective tissue.
Flower.
You are so good at this. You're so good at this. Thank you. We have to hang them on my wall, okay?
Can I see it on my lap?
So, hold on. The hypermobile EDS, although prevalence estimates aren't available due to the recency of changes.
Is this glass?
Nope. Within its diagnostic criteria.
Can I drop it?
No. It is believed that by most clinicians, researchers, and patients to be a common condition occurring in greater than 1 in 2,000 people. Unlike the other forms of EDS, there are currently no recognized gene mutations with HEDS, although that will hopefully change with current effects.
Look, it looks like my tooth.
Current efforts to perform whole genome sequencing in a large number of people. I can't read. Shh. I'm trying to read. Quiet, please. So it's talking about recent research suggests EDS may have strong links with autism. Case studies have previously been published and identified, but in 2016, a study performed in Sweden indicated that people with EDS are more likely to be diagnosed with autism than individuals without the condition. More research has also shown that autistic people have higher rates of joint hypermobility. Hold on. In general, a major feature of EDS. So, more recently, this autism.org has their own lab has found that mothers with EDS or a diagnosis of the closely related hypermobile spectrum disorders, formerly known as joint hypermobility syndrome, are all just as likely to have autistic children as mothers who themselves are on the autism spectrum. This suggests that maternal EDS HSD may be a significant risk factor for the development of autism in children. Now, I did look into this a little bit.